Hi, I'm Dr. Reginald Liew. I'm a cardiologist at the Harley Street Heart and Vascular Centre. I look after patients with general heart conditions like heart failure, coronary disease, hypertension, but I specialise in cardiac arrhythmias or heart rhythm problems. So I look after a lot of patients with different arrhythmias and perform ablation and catheter ablation and pacemaker procedures. The sensation of palpitations is very common. A lot of people feel palpitations at some stage of their life. It may be due to stress or anxiety, but may also be a symptom of more serious underlying heart problem. So I'd like to talk about palpitations to increase the awareness of this symptom and how we can best manage these patients. People can get palpitations for a number of reasons. It may be due to external factors such as excessive alcohol intake, sleep apnea, obesity, stress, excessive caffeine intake. But also some people get palpitations because of their underlying heart problem. Some people have high blood pressure, coronary artery disease that can cause weakness or problems with the heart muscle. Other people actually have primary heart rhythm problems where they have excessive heartbeats or too slow heartbeats that can also need specific treatments for their condition. I often say to patients, try to exercise more, keep a healthy lifestyle, reduce alcohol and caffeine intake, and also have a general checkup as well, because there may be an underlying heart reason for their palpitations. The first thing I do is to assess the patient's profile. I assess whether or not they have underlying medical issues or lifestyle reasons for the palpitations. Having addressed the lifestyle issues, if we think there's a medical problem that needs further treatment, we often do some tests to try to find out if there's an underlying heart reason. We try to document the palpitations by putting some sort of heart rhythm monitor to confirm the problem. And if we confirm there are specific arrhythmias, we then start treatment. It may be treatment for the underlying heart rhythm problem with medication, or sometimes we treat other heart problems like high blood pressure or sleep apnea or heart failure. So many patients have a primary care doctor that they often see when they first experience a symptom. So it's very important, the relationship between primary care and the specialist care. Palpitations being so common a symptom are often seen at all ages, and the primary care doctor will usually be the first person that the patient sees. I would advise a doctor to assess the patient carefully in terms of their risk profile. So for the older patients, even if they appear to be in normal rhythm by the time they see you, they may actually have palpitations due to atrial fibrillation, which, as you know, can increase the risk of blood clots and stroke. So it's important, even if they are in normal rhythm, to assess them carefully to assess for dangerous heart rhythm problems. Likewise, some patients may have palpitations due to underlying heart failure or coronary artery disease. So if in doubt, best to do further cardiac tests to pick up these underlying problems. And of course, even in younger patients, the palpitations may be due to lifestyle factors like stress or alcohol intake, but they may also have underlying arrhythmias such as supraventricular tachycardia, or increasingly we're seeing atrial flutter and even atrial fibrillation in younger patients. So I would say that the primary care doctor needs to determine the potential reasons for the palpitations and to perform or arrange for additional tests or refer to specialist care if they think there's an underlying issue.
So, Dr. Liew, what's one of the most memorable palpitation cases you've managed?
Oh, I've seen a lot of interesting cases, but one that particularly comes to mind is a young lady that I looked after a few months ago who was postpartum. She had just delivered her first child, and she developed more and more palpitations, particularly when she was breastfeeding. And because she was breastfeeding, she didn't want to take any medication. But when we did the Holter monitor and the tests, we found that she had a lot of ventricular ectopics which were causing her symptoms. So despite observation and watching and seeing if it improved, we found that they actually got worse. Eventually they were so bad that she needed to have a catheter ablation procedure. We performed the procedure, we identified the exact spot causing the ectopics and successfully ablated the problem. So when I saw her in clinic, she was feeling very, very happy. She had no further symptoms, and in fact she was breastfeeding and not needed to take medicine. So I was particularly happy with the case because she felt very happy afterwards and we managed to avoid the need for medication. And she otherwise will do very well. She doesn't need any other cardiac treatment in the future.